Baby hiccups. 101 Causes, Prevention, and Relief Techniques. If you're a new parent, one of the things you'll inevitably experience is your baby getting the hiccups. While hiccups are usually harmless and temporary, they can be unsettling and uncomfortable for babies and parents alike. But don't fret, baby hiccups are a common part of infant development. In fact, babies can start hiccuping as early as in the womb. Today, we will cover everything you need to know about baby hiccups, what causes them, tips for prevention, and effective relief techniques to soothe your little one. The causes of baby hiccups. To better understand how to prevent and treat hiccups, it's helpful to first look at what causes them in babies. While hiccups may seem random, there are actually several common culprits behind those tiny contractions: overfeeding or eating too quickly. One of the top reasons babies get hiccups is overfeeding or gulping down milk or formula too fast. When babies consume too much too quickly, they can swallow excess air, which gets trapped in their stomachs. This air buildup puts pressure on the diaphragm, the muscle used for breathing, triggering those telltale hiccups. Immature digestive system. Newborn babies' digestive systems are still developing and immature compared to older babies and children. Their esophagus, the tube connecting the mouth to the stomach, is relatively narrow and underdeveloped. This can allow gas, milk, or burps to irritate the esophagus more easily, resulting in those pesky hiccup contractions. Stomach distension. Babies, especially newborns, have very tiny tummies. It doesn't take much to overextend or distend their little stomachs. Overfeeding, gulping air, or even crying can bloat that little belly, leading to uncomfortable hiccups. Reflux. Gastroesophageal reflux, often just called reflux or acid reflux, is another common hiccup culprit. Reflux occurs when stomach contents like milk or acids back up into the esophagus rather than staying down in the stomach where they belong. This backflow can irritate and inflame the esophagus, causing hiccups as a side effect. Developmental factors. As babies grow, their nervous systems, muscles, and biological processes constantly develop and mature. Sometimes hiccups can be a side effect of these normal developmental processes and changes in a baby's tiny body. Preventing those pesky baby hiccups. While you can't eliminate hiccups entirely, there are some good preventative measures to reduce how often and severely they occur. Burp your baby frequently. One of the most effective preventative tactics is to burp your baby regularly during and after feedings. Gently patting or rubbing their back can help release any built-up gas bubbles before they have a chance to cause discomfort and hiccups. Get in the habit of burping about halfway through feedings and again at the end. Slow down feedings. If your baby is a notorious gulper who chugs down milk or formula too fast, slowing their roll can help prevent hiccup episodes. Take regular breaks during feeding sessions to burp them and allow them to breathe and digest a bit before continuing. Removing the bottle or unlatch from the breast for a minute can prompt them to slow their pace. Avoid overfeeding. It can be tempting to try to cram in those last few ounces when feeding, but overfeeding will only increase the chances of hiccups and spit-ups. Pay close attention to your baby's hunger cues, like turning away, fussing, or slowing their eating pace, as signs that they've had enough. Stop the feeding when they seem full and satisfied. Use a pacifier. Allowing your baby to suck on a pacifier during and after feedings can sometimes help reduce instances of hiccups. The sucking motion can prevent excess air from being swallowed compared to guzzling from a bottle or breast. It can also provide a calming effect. Stay calm. Babies can pick up on their parents' emotional states. They'll likely sense it and get more distressed if you get anxious, uptight, or agitated about their hiccups. Maintaining a peaceful, relaxed presence can sometimes be enough to short-circuit a bout of hiccups before it ramps up. Take some deep breaths and don't let the hiccups rattle you. Providing relief. Hiccup stopping techniques. Despite your best prevention efforts, hiccups will still inevitably happen sometimes. When hiccup episodes happen, here are some relief techniques to try with your baby. Burping and back patting. As with prevention, burping is one of the most effective relief tactics for hiccup episodes that have already begun. Hold your baby upright against your shoulder or lap, leaning slightly forward. Firmly but gently, pat or rub their back to coax out any trapped gas bubbles causing the hiccup contractions. The massage movements combined with the change in position can do wonders. Gripe water. Gripe water is an over-the-counter liquid supplement formulated with herbs and other ingredients to help relieve infants' gas, hiccups, and general stomach discomfort. The most common ingredients are dill, fennel, ginger, and sodium bicarbonate. Gripe water is relatively safe when used as directed, but check with your pediatrician first, especially for newborns. Pacifier or finger sucking. Having your baby suck on their pacifier or a clean finger can sometimes break the hiccup cycle. The sucking helps relax the diaphragm muscle, while the swallowing motion may dislodge any irritants causing the hiccups in the first place. This is often one of the quickest, easiest remedies to try. Gentle tummy massage. Gently massaging your baby's belly in a clockwise circular motion can help relieve hiccups caused by gas and digestive distress. Be very gentle and don't press too firmly. Moving their legs in a gentle bicycling motion can also help work out gas pockets. Rocking and soothing. Rocking your baby in your arms, a swing, or a bouncer can sometimes stop hiccups through gentle, rhythmic motions. The rocking helps relax the diaphragm, while the warmth and closeness of being held provides a calming distraction. Singing, swaying, or softly shushing can enhance the soothing effects. Stay calm and patient. As with prevention, it's important to keep your cool and not let your baby's hiccups rattle you. Maintain a relaxed, patient demeanor, and don't get anxious or agitated as you work through the various relief techniques. Getting tense and upset will likely only prolong and intensify the hiccup episode. Other tips and considerations. Switching feeding positions. Alternating between different feeding positions, such as cradle, upright, or laid back, can help minimize air intake in different ways. Finding the right ergonomic latch or angle can also make a difference. Gas drops. Over-the-counter anti-gas medication drops containing simethicone can sometimes provide relief by helping babies pass gas more easily. However, check with your pediatrician before using any medications. Pacifier types. Not all pacifiers are created equal. Some have unique shapes and venting systems that may be more effective at reducing air intake than traditional pacifiers. Experiment to see if any work better for your baby. When to call the doctor. While hiccups are generally harmless and temporary for babies, there are some red flags that indicate you should call your pediatrician. These red flags include hiccups lasting longer than a few hours, vomiting or reflux with every bout of hiccups, and signs of distress like trouble breathing or fever with hiccups. Most of the time, however, hiccups will resolve within 10 to 15 minutes by simply allowing the baby to work through them. Using the relief techniques above can help shorten episodes when needed. The good news is that as babies age, hiccup episodes tend to become less frequent and less severe. Their digestive systems mature, they become better at pacing feedings, and their esophageal muscles strengthen, all of which reduce common hiccup triggers. So while those first few newborn months can be a hiccup-filled roller coaster, this too shall pass. When hiccups are more than just hiccups. In very rare cases, persistent or chronic hiccups in infants can be a symptom of an underlying medical condition, gastroesophageal reflux disease, GERD. While normal infant reflux can cause hiccups, severe and chronic reflux is a condition called GERD, which may require medical treatment. Signs include frequent vomiting, poor feeding, and little weight gain. Metabolic disorders. Certain inherited metabolic disorders that affect how proteins, fats, or glucose are processed in the body can sometimes manifest with persistent hiccups as a symptom. Neurological conditions. Hiccups can be linked to injuries or abnormalities in the nerves that control the diaphragm muscle, like damage from trauma, tumors, or conditions like multiple sclerosis. Gastrointestinal issues. Problems with the gastrointestinal tract, like intestinal obstructions, hernias, or masses pressing on the diaphragm, may rarely cause chronic hiccups in infants. Again, these are very uncommon cases. For most babies, hiccups are simply a brief nuisance related to feeding, gas, and development. But it's still wise to mention any concerns about frequent, severe, or prolonged hiccup episodes lasting more than a day to your pediatrician. Baby hiccups are common and usually harmless, but they can be unsettling for babies and parents. Understanding the causes and trying various prevention and relief techniques can help alleviate your little one's discomfort. Remember to stay patient and calm, and don't hesitate to seek medical advice if the hiccups persist or if you have any concerns. With time and experience, you'll become an expert in managing your baby's hiccups, ensuring their comfort and peace of mind.